It's Thursday, February 17. This is the news on PBCJ. I'm Gabrielle Thompson. We begin with some positive news for the Jamaican economy. The Planning Institute of Jamaica, the PIOJ, is reporting that the economy grew by an estimated 6% during the third quarter of the fiscal year when compared to the October to December 2020 corresponding period. PIOJ Director General Dr. Wayne Henry made the revelation during the Institute's digital quarterly media briefing on Wednesday.
The estimated outturn for the review quarter largely reflected the impact of one, the continued relaxation of COVID-19 containment measures globally, which facilitated increased domestic and external demand, resulting in a general uptick in economic activities. Two, increased operating hours for businesses, which facilitated higher capacity utilization rates and production levels. Three, higher levels of employment as firms either resumed or ramped up operations. And four, increased business and consumer confidence associated with the prospects for strengthened economic outturn and increased employment in the short to medium term.
This is the third consecutive period of growth recorded since the April to June 2021 quarter. Analysts suggest it is a strong signal of the country's recovery from the economic fallout caused by the COVID-19 pandemic. While the mining sector recorded a decline of 23.6%, economic growth was led by two of the four goods-producing subsectors, namely agriculture, forestry and fishing, which expanded by 12.1%, and construction by 6.4%. Dr. Henry says the increase in demand in the agriculture sector was mainly driven by tourism.
Growth during 2021 was led by hotels and restaurants, up 36.4%, construction up 9.1%, agriculture, forestry and fishing up 7.9%, and wholesale and retail trade, repairs, installation of machinery and equipment up 6.6%.
The PIOJ spokesman also examined the short-term prospects for the Jamaican economy.
Generally, the prospects are positive, given the expected impact of the further easing of the previously implemented COVID-19 containment measures. This will facilitate continued resumption or expansion of economic activities in most industries. Additionally, the further opening up of the economies of Jamaica's main trading partners will support higher levels of external demand, particularly for tourism-related products and services. Increased employment levels and the strengthening of business and consumer confidence levels are expected to support greater domestic demand in the short to medium term.
Jamaica National Bank says counterfeit checks are in circulation. It is urging its members and the public to exercise caution when accepting JN managers' checks. The bank says in a statement that its teams are in contact with the authorities, but customers should not hesitate to contact its member care center about any concerns about checks they may have received. Government says it remains resolute with its plans to increase the number of housing units available to Jamaicans through the new social housing program. Speaking at the official handover ceremony for a 3-bedroom unit in Donmere Close in St. Andrew North Central, Prime Minister Andrew Holness said the program will be expanded to provide more houses to Jamaicans in need, as well as transform their lives. Simone Absalom Gale has the details.
Once I'm satisfied that we have everything in place from the administration, from the monitoring and accounting, the architecture and engineering, and the financing, then we will start to scale up. Right now, we intend to complete 122 such housing solutions we're going to be building in this phase. But in the next budget, we're going to seek to double that. And as we expand, we will be able to reach far more Jamaicans.
The Prime Minister also reported that his appeal to members of the private sector to partner with and support the government through the initiative is bearing fruit.
Already, we have seen a few companies reach out to say, we would like to help, because this is, at the core of it, this is about giving hope to people in despair. It is about saying to people who live in communities like these that you are not forgotten, that you too deserve proper housing, and that the government is allocating out of its budget resources to deal with the worst of the worst situations.
Mr. Holness also reminded the recipient of the new housing solution that occupants must be model citizens in the community and ambassadors for the Housing Opportunity, Production and Employment Program, otherwise known as HOPE.
We don't want people in this house who are going to be associated with guns and gangs and killings. So you, in this regard, must be an ambassador, including for the young ones who may be so distracted and diverted into crime and other kinds of activities that are not beneficial to us as a people.
Minister of Labour and Social Security and Member of Parliament for the constituency, Carl Samuda, who was also on hand, said work will continue to ensure more persons can benefit from the initiative. The unit was built at a cost of $6.1 million in approximately 2 months. The social housing program was established in 2018 by the Prime Minister as the housing component of the HOPE program to improve the housing condition of those in need.
Government will be spending $1 billion on the National HIV/AIDS Response in Jamaica project in the coming fiscal year. This is with a view to reduce AIDS-related morbidity and new HIV infections through behavioral and structural interventions. Details of the project are outlined in the 2022-2023 estimates of expenditure, which are before the Standing Finance Committee of the House of Representatives. According to the Jamaica Information Service, JIS, up to the end of December last year, a total of 3,854 at-risk men were reached with HIV prevention programs and 265 transgender persons were served. Additionally, over 3,000 men who have sex with men got tests and results, and 218 transgender persons also got tests and results. JIS says the project also reached over 3,000 men who have sex with men with syphilis tests and results. Close to 5,000 females who have sex with other females received HIV prevention programs, and another 4,000 received HIV tests and results. The program achieved an enrollment of 1,116 adults and children in antiretroviral therapy services. The region's premier health agency, the Pan American Health Organization, PAHO, says the rate of vaccination against COVID-19 in Latin America and the Caribbean remains low. Director of PAHO, Dr. Carissa Etienne, has expressed the concern while reporting that number of doses of COVID-19 vaccines delivered by the organization through its revolving fund has reached 100 million.
Many people in our region remain unprotected against COVID and have yet to receive life-saving vaccines. Unvaccinated people of all ages are still filling up our hospitals and ICU beds, and too many are succumbing to this virus.
Dr. Etienne notes that while 63% of people in Latin America and the Caribbean have now been vaccinated against COVID-19, coverage remains uneven, with 14 countries and territories, including Jamaica, yet to immunize even 40% of their populations. Haiti remains at the bottom of the list with vaccine coverage of less than 1.2%.
We need to activate our response more rapidly to keep pace with the current wave and to stay ahead of future surges of this very fast, very serious virus. And that's why we're urging countries to focus on filling in critical gaps in vaccination coverage. To meet the WHO's 70% coverage target for every country, our region must ensure that at least 20 million more people receive all the vaccine doses.
The PAHO Revolving Fund is the designated procurement agency for COVAX in the Americas supplying doses to 33 countries. As Jamaica marks 2022 as the year of early childhood development, the Early Childhood Commission, ECC, is seeking to raise awareness about the importance of early child development. Chairperson of the Regulation and Certification Committee of the ECC Board, David Salmon, says the Commission is also hoping to bring about some much-needed improvements. Currently, there are about 2,500 early childhood institutions operating across the island. These provide education for children from 0 to 5 years of age. Mr. Salmon says one of the important goals of the ECC is ensuring that these institutions are all registered in keeping with the Early Childhood Act and are meeting the standards outlined by the government. February 17 has been declared Global Tourism Resilience Day by Minister of Tourism Edmund Bartlett. He made the declaration as he addressed the Global Tourism Resilience Forum in Dubai at Expo 2020. The annual day will showcase the need for the travel industry to focus on preparedness, crisis management, recovery, and ongoing resilience, and the minister stressed that the industry has learned a lot from the current pandemic, but still has some ways to go.
The pandemic has highlighted societal weaknesses which show themselves vibrantly within the travel sector. We are here to not only raise the global consciousness about resilience, but to bring forth actions that demonstrate what can be done and is being done to prepare to be resilient.
The minister says the tourism sector can regenerate itself and points that this was evident post-SARS, the terror attacks of 9/11, the economic disruption of 2007 to 2008, and now the coronavirus pandemic. He also notes the devastating hurricane of Maria, which caused major damage in the Caribbean, affecting Antigua and Barbuda, Dominica, and Puerto Rico. Out of this, 3 points of action have been developed.
1, the establishment of a crisis resilient management center to create an institutional framework for academic rigor and for study and for mining of data and communication, and to be able to offer to the world community guidance as to how to, 1, identify disruptions. Secondly, to mitigate against disruptions. Thirdly, to manage disruptions when they actually come. And fourthly, to recover quickly. And fifthly, to thrive.
Speaking at the event, Global Tourism Resilience and Crisis Management Center co-founder and a former General Secretary of the United Nations World Tourism Association, Taleb Rifai, confirmed a new resilience center will be founded in Amman, the capital of Jordan. This location follows centers in Jamaica and Nairobi, the capital of Kenya. A further 8 centers will be unveiled in the coming months. Time now for the daily market updates with the Business Report. For a 5th week, motorists will dig a little deeper into pockets and purses as effective February 17, there are increases in the prices of gasoline and diesel. 87 and 90 octane gasoline are both up by $3.06 and will be sold for $180.90 and $185.92 per liter respectively. Automotive diesel fuel saw a $4.50 price hike and will be sold for $183.66 per liter. Ultra-low sulfur diesel is also up by $4.50 and will be sold for $188.16 per liter. Kerosene continued the $4.50 price hike and will be sold for $158.27 per liter. Propane liquid petroleum is down by 56 cents and will be sold for $76.04 per liter, and butane liquid petroleum will be sold for $85.89 per liter, following a decrease of 25 cents. Be on the lookout for price changes as marketing companies and retailers will add their markup to these prices. In foreign exchange trading for Wednesday, February 17, the US dollar sold for an average $157.42. The Canadian dollar ended trading at $123.98. The pound sterling traded for $213.67, and the euro sold for an average $182.15. In Wednesday's trading session, the following reflect the movement of the JSE indices. The JSE index declined by 1,604 points to close at under 400,000 units. The junior market index declined by 58 points to close at over 3,000 units. The combined market index declined by 2,017 points to close at over 400,000 units, and the All Jamaican Composite Index declined by 1,070 points to close at over 450,000 units. Overall market activity resulted from trading in 107 stocks, of which 44 advanced, 46 declined, and 17 traded firm. Stocks advanced for 1834 Investments Limited, Berger Paints Jamaica Limited, and Blue Power Group Limited. Stocks declined for 138 Student Living Jamaica Limited, Access Financial Services Limited, and AMG Packaging and Paper Company Limited. Trading firm were 138 Student Living Jamaica Limited, Variable Preference, CAC 2000, 9.5% Preference Shares, and Siboney Group Limited. Stanley Motor Limited Ordinary Shares was the volume leader with over 10 million units, followed by Wigton Wind Farm Limited Ordinary Shares with over 4.5 million units, and QWI Investments Limited with over 3.2 million units. In market data for oil, prices fell on Thursday as talks to resurrect a nuclear deal with Iran entered their final stages, but losses were capped by heightened tensions between top energy exporter Russia and the West over Ukraine. Brent crude traded down $1.26 or 1.3% at $93.55 a barrel. West Texas Intermediate crude futures were down $1.34 or 1.4% at $92.32 a barrel. Both contracts fell more than 2% earlier in the session. In regional news, we begin in the Bahamas, where an Auditor General's report on the Tourism Ministry is revealing new information about the Bahamas Travel Health Visa. Officials say contracts were not executed in accordance with regulation, competitive bidding was not pursued, and some services commenced with only verbal agreement. Tourism Minister Chester Cooper says it's clear some mistakes were made. Jasmine Brown reports.
The 32-page audit revealed several details about the travel visa program, including which contracts were signed with whom and how much money was made. The audit, which covered the period November 1st, 2020 to August 31st, 2021, was tabled in Parliament. The report also stated that contracts for the BHTV program were not executed in accordance with the Financial Regulations 1975, Section 21, which states all awards of contracts for supplies, works, and services required by the government in excess of $250,000 shall be made by the Cabinet. The audit also stated that no competitive bidding was pursued and the said services commenced initially with only a verbal agreement. The signed contractual agreements were executed several weeks, months later.
Former administration made some mistakes. This is just a few of the many mistakes they made during the administrative period.
In the case of Canoe, which was responsible for executing monthly payments to all vendors, a contract was never officially signed. This despite the Auditor General's report noting Canoe's contract length was from October 27, 2020 to October 26, 2021. And that's not all. As the Auditor General's report also stated, the opening of a bank account with Canoe on the Bank of the Bahamas violated the Financial Administration and Audit Act 2010, Section 24. Past Bastian also audited the financial results of the travel visa program. Bastian said the Tourism Ministry reported gross revenues of $34,442,104 and total expenses of $23,657,900 and net amounts of $10,784,204 transferred to the Consolidated Fund for the 10-month period of November 2020 to August 2021.
In news out of Guyana, the Ministry of Health has approved the use of self-testing kits for COVID-19, but the results of the test will not be accepted for travel. In the case of positive results, persons should isolate themselves at home and a report made to the Ministry of Health. If they experience symptoms, then medical help should be sought. Guyana continues to see a decline in active COVID-19 cases and hospitalizations.
There are some people who would buy the kits and would follow the guidance, but it's not widespread, and therefore we don't see a big challenge. Now, with self-testing, it's a way of just, if you have any concern, to check to see whether you're positive or negative. So, first of all, I think not a lot of people would be doing it, and those who would be doing it, I think they would be responsible enough if they test positive to report it to our surveillance system.
The Minister of Health also added that once a positive result is presented to the Ministry of Health, then the ministry will decide on whether the person should undergo a second test, which will be administered by the ministry.
So if somebody would have used a self-testing kit and they're positive, they should report it so that we have them in our account.
In terms of international travel, the health minister warned that a self-test will not be accepted for outgoing or incoming passengers.
So self-testing is a concept that you have in different countries. Our travel requirements are very explicit. We are accepting an antigen test from a reputable institution where it's done, or a PCR test. There is something now called a rapid PCR, and we are also accepting that. So any of these three tests we're accepting. Home kit, somebody having a home kit and doing a test at home does not necessarily qualify or meet the requirements of travel. No country right now is accepting anybody who has tested themselves at home for travel.
Power across Trinidad is slowly being restored after last afternoon's outage. From about 12:50 p.m. Wednesday, most of Trinidad was without an electricity supply. The cause of the power outage is still unknown, but the Trinidad and Tobago Electricity Commission, T&TEC, says their engineers continue to work to have the issue resolved soon. More details from TTT Live.
Right now is that the independent power producers are restarting all their generators. This is a process that takes some time, and it is going to lead to a gradual restoration of supply to all customers. The process to restart and to get the customers back on supply incrementally will take approximately 2 to 3 hours.
Power has been restored to some communities in South Trinidad. T&TEC says restoration will continue over the next few hours. Meanwhile, the supply of pipe-borne water was also affected, with the Water and Sewerage Authority saying that some 40 water treatment plants, 107 booster stations and 210 groundwater sources were negatively impacted. Whilst it says it will restart the facilities once power is restored. Persons can contact T&TEC's social media pages for updates.
Many Grenadians fret about having to wear face masks in public spaces due to the continued coronavirus COVID-19 pandemic. But a medical doctor in the country says apart from curbing the spread of the virus, it is helping some people who battle respiratory illnesses. More details from GBN News.
Acting Chief Medical Officer Dr. Taisha Donald says results show that the wearing of masks have helped in decreasing the number of respiratory complaints received at health facilities in the country.
The little organisms and so would be trapped. And we're also protected from external factors in terms of your pollen and so, because of course we're wearing masks. So what we've noted is that in terms of respiratory illness, and I'm a pediatrician, so I could also speak to that. We have not seen a significant number of persons with respiratory illness based on the fact, of course, it's all related to the wearing of the face mask. So persons, we have some protection there, if we can call it that.
Face mask was introduced in 2020 following confirmation of the country's first COVID case. Legislation was implemented under the emergency powers in 2020 for every citizen to wear a mask or suitable covering over their nose and mouth whenever they leave their home, attempt to enter, or is in line to enter a place of business, government offices, and while in a motor vehicle with any other person. She said the face mask was very beneficial as health officials did not have to battle with a major intake of patients battling respiratory issues.
So there's been a decrease, but we continue to have, but not as much as we would have seen, particularly, for example, in the flu season. So let's say between September and March, normally we see quite a number of patients with asthma, wheezing, bronchiolitis, these type of illnesses, bronchitis. But now, of course, we still see these cases, but not as much as we would have seen in the past because, of course, persons are being protected by wearing the face mask. So the face mask has really helped us in that sense. So we have not had to battle with so much with the traditional respiratory illnesses plus the COVID. You know, the COVID ones were the ones predominating. But the wearing of face mask has impacted in terms of these numbers. All right, so I hope
While some COVID protocol measures were further relaxed on Tuesday, Grenada remains under a state of emergency, which is expected to expire in May, unless discussions set for next week take that off the table. Cherry and Blackman Stephen, GBN News.
And now for sports. Jamaica's senior reggae girls will begin their World Cup quest on Thursday. They are set to go up against Bermuda in the first phase of the CONCACAF Women's Championship qualifying game at the National Stadium. Game time is 7 p.m. The Jamaicans have been placed in Group C, which also includes Grenada, Cayman Islands, and the Dominican Republic. And with that, we call an end to the news on PBCJ. On behalf of our entire news production team, thanks for watching. This is PBCJ, the People's Station.